Hello, everybody. This is Dr. Tam and Rocky here for another amazing episode today. And every single day, we're going to give you information on how you can improve your health, decrease pain, but also function and longevity. So, Rocky, tell us a little bit more about what we are going to talk about today.
Yeah. So, last episode we talked about, peripheral neuropathy, the
Yes.
signs and symptoms, causes, and possible treatments to improve the condition. And one of the, possible treatments that we discussed the last time was regenerative therapy, right?
Hmm.
So today, we have some questions from our viewers, and let's start with what is regenerative therapy?
Well, so regenerative therapy, some people know it as regenerative medicine. I mean, that's been around for a long time. See, our body is made to heal itself, right?
Mm-hmm.
When we are a child or a baby, when you get a bruise, how quickly does it heal? It heals within like 2 days, one
Yeah.
to 2 days max, and the bruise is gone, right?
Mm-hmm. Right.
But as we get older, what tends to happen is that bruise stays a little bit longer.
Mm-hmm.
I don't know about you. I noticed it when I was about 25. That
Yeah.
bruise started staying a little bit longer
Mm-hmm.
as time went on.
Right.
By the time I was 35, my gosh, that bruise was there for like 2 weeks, Like, what the heck happened? And I wouldn't even know what happened. And what happened is as we get older, our cells do not regenerate and do not heal as quickly. So what happens is whether it's nerves, tissues, or joints, if we're doing things that are depleting or degrading that area faster than it's healing, well, it's going to break down. It is a progressive disease. It breaks down over time, right? Where there's degenerative nerve disease, degenerative joint, or disc disease, right? So in regenerative therapy, what it is that it's called tissue allograft. And the tissue allograft is something that is harvested from the Wharton's jelly, right, of the umbilical cord.
Mm-hmm.
And the key is that these are new cells, an allograft that's going to be able to accelerate the healing factors in the body and help the body really not only give its room to regenerate, but also assist in the healing factors that the body has. And that's why it's so powerful, right? It's giving the body the space, the room, the nutrients that it needs so that your body can re-heal as quickly as possible. And that's really the key thing of regenerative therapy.
To help the body heal, right?
Yeah.
Is it similar to stem cell therapy or?
So yeah, that was a word that was used a while back where people would call it stem cell therapy, right? And still a lot of people know it as, oh, is that stem cells, right? There's been a lot of changes in wording. There's mesenchymal stem cells, there's stem cells, there are different terms that are used. But we like to call it, regenerative therapy utilizing tissue allograft, right? So that's what it is what the actual tissue is that it's a tissue allograft from the Wharton's jelly, of the placenta. And that's ultimately what that is.
I see. All right. And how does the treatment work? Do we get into surgery? How does it work?
The great thing is there's no surgery. There are injections in multiple areas for neuropathy. On the more severe neuropathy, we do offer multiple injection sites. There are injections that could be done on shoulders, knee, hips, the neck and back area, right? Ankle, feet, hands, wrists. So ultimately is depending on what area is damaged or the area determined by our medical staff that needs the injections to be based on the protocols that we have, then that's where it's injected. And then over time, the body takes in those cells, the exosomes, that is actually signals the body to accelerate the healing factors that are in the body, to allow the body to make sure that it's treated the right way so that the body can heal.
Right. Yeah, because I'm sure that a lot of our viewers are afraid of
Yeah.
that, because when you hear stem cell surgery or regenerative therapy, somehow you would think about, oh, am I gonna go under the knife? And a
Yeah.
lot of our viewers are definitely afraid of that.
Oh,
Now,
no doubt.
yeah. Now, now that we know what it is, um,
Yes.
how will I know, or why should I even consider this therapy? Or am
Well,
I even eligible to get this
yeah. Are you
therapy?
even eligible? The
Right.
only thing to tell if whether or not you're eligible is to really get a consultation to see how far gone the nerves are, right? Um, Ultimately, we take people through a test that is a 24-point test to see sensory wise, balance wise, where your nerves are. Or maybe they're too far gone, right? There's a magic number, 85. If your nerves are past 85% gone, which means that the sensory is just no longer there, then the nerve only has 15% life left.
Mm-hmm.
Anything less than 50%, 15% life, you can't save that nerve. That
Mm-hmm.
nerve is almost gone. So there's nothing we can really do about it, but anything less than 15% or anything more than 15%, then ultimately we're able to help the nerve recuperate some of its functions back. And there's hope for the patient. See? So, of course, you don't want to wait until it's really, really bad, right? Sometimes the neuropathy can be necrotic, or it can tear down the muscle and cause a lot of atrophy where you can't save it anymore. So the key thing is figuring out where they're at. And after a certain percentage, we do offer and we do recommend regenerative therapy and the tissue allograft for some of the patients with neuropathy.
Mm-hmm. Right. And is it only applicable for patients with neuropathy, or?
No, it's actually, regenerative therapy and tissue allograft are used for patients not only with severe neuropathy, but also severe degenerative joint disease.
Mm.
Sometimes, maybe in the knee, shoulder, hips, neck, and back, right? And it accelerates the healing of the body and assists in giving it space, but also cushion. It provides cushioning for the joints. That's one
Mm.
of the main key things that the tissue allograft does. A lot of athletes use it. A lot of movie stars do it. They
Mm.
used to have to go abroad over to Europe to get this done.
Yeah.
But now it's been done all over the US and makes it very, very convenient. The cost of it has came down compared to before.
Mm-hmm.
And depending on how many cc's you may need, well, that's where our consultation and the exam and x-rays come in to
Mm-hmm.
figure out exactly what's needed. So those who are interested should definitely give us a call, because we've helped a lot of people who have gone through the procedure, get through it,
Mm-hmm.
possibly even prevent surgery as well in the long run, or at least delay it if
Right.
possible.
Mm-hmm. Yeah. So, yep, definitely you can give us a call so that we can start your journey to regenerative therapy. Now, just in case, Dr. Tam, let's say I am ready for that consultation.
Mhm.
How do I prepare myself for what are the
Oh,
things
there's
that
not
I
much
have to
preparation.
prepare? Mm-hmm.
First, you just got to come for a consultation first.
Mm-hmm.
And depending on what the problem actually is, then we'll let you know what the protocols are going to be.
Mm,
Yeah.
all right.
It's a simple protocol.
All right, great. And does it 100% reverse the condition, or not at all?
Well, in medical, the good thing is nothing's 100%,
Yeah.
right? There's no guarantees or 100% for anything. We do the best that we can, and you have to play your role as well. As a
Mm-hmm.
patient, if you're not doing your part, then the success rate is not going to be very high, right?
Mm-hmm.
But if we do both our roles, then we have seen some very high success rates.
All right, perfect. All right, well, thank you again, Dr. Tam, for answering our questions about regenerative therapy. Now, just like what Dr. Tam said, if you think that you need, or if you are considering to do regenerative therapy, then you can give us a call. You can comment below, or you can message us on Facebook, so that we can guide you on your next steps. So
Okay.
thank you so
Yeah, we
much,
definitely
Dr.
will.
Tim. And
Thank you so much, Rocky.
all
Bye bye
right,
now.
bye bye.